Hi guys! I got inspiration for our segment today from one of our loyal listeners at the Joey and Heather Morning Show. Go check them out on 98.9 if you haven't listened to them. But one of our callers sent a picture and a story where her daughter had caught this animal and had it wrapped up as a baby in a blanket. So here's the picture. Yeah, that's an armadillo. And if you don't know, armadillos can cause leprosy. So today we're going to talk about leprosy. Also, if you see an armadillo out in the day, it's probably sick and I wouldn't recommend going near it anyway. It's the 9-banded armadillo that is typically the one that carries leprosy around with it. I didn't stop to count the bands in this picture to see if it might be infected. However, I did recommend getting rid of the blanket and making sure that we don't play with that armadillo anymore. So, what is leprosy? We read about it in the Bible and we hear about it from history. It is a bacteria called Mycobacterium leprae. Now, we hear about Mycobacterium tuberculosis, different bacteria, but they both can be devastating. The nice thing about Mycobacterium leprae is that it's not extremely contagious. And if caught early, it's very easily treatable. It's important that the person be identified as having leprosy, also known as Hansen's disease, and there is a Hansen's disease registry in the United States, so that the person can be treated so that they don't go on to have the devastating symptoms of damage to their peripheral nerves and the skin, their hands, feet, and eyes in particular. Cooler areas of the body tend to be the most infected: nose, hands, and feet. Also in men, testicles. Just because of the range of temperature, where it tends to thrive the most is a bit cooler than the rest of the body temperature. We tend to see more cases develop in resource-limited areas of the world, certain parts of India, Brazil, Indonesia, the Republic of Congo. So if people have traveled to these areas or have been exposed to animals with known risks, like armadillos, then we certainly want to be mindful of that. Also, they've identified it in red squirrels in the UK, although cases in the UK of humans, very, very low, and of chimpanzees in West Africa. So it is reported we had less than 150 cases in the United States last year, so it's not eradicated, but it is very well controlled. The great news for people who may be affected by Hansen's disease or leprosy, because of its not highly contagious nature, these people don't need to be isolated. You don't have to have leper colonies like they used to, and these people aren't unclean. They just need to be identified early and treated, and we typically use multi-drug regimens of therapy with antibiotics so that the risk of developing antibiotic resistance is low. There is not one set regimen of these medicines, but it's usually a triple therapy. In most places, the therapy lasts at least 12 to 24 months, if not many years after that. So, a little bit of interesting historical medical knowledge for your day. I hope you enjoy, and stay away from the armadillos. Don't forget to like and subscribe, and stay tuned for more.